Every day, hundreds of millions of patients suffer from autoimmune skin diseases like alopecia areata, psoriasis, and vitiligo, conditions that physically debilitate, increase the risk for developing other ailments, and profoundly impact mental health. These diseases are more than skin deep. They are a global health crisis that demands immediate attention. Despite the fact that these diseases manifest themselves very differently, they all share the same etiology, dysregulation of the immune system, where a subpopulation of T cells, effector T cells in our body, become autoreactive and attack healthy cells. Current treatments are limited by their broad immune suppressive effect that result in an increased risk for infections, other ailments, malignancies, as well as high relapse when the treatment stops. Rather than suppressing the entire immune system that puts the patient at a higher risk for developing diseases, there's the need to develop precise and more effective and safer methods. We are each born with billions of clones of T cells, each designed to recognize a particular antigen and together protect us from diseases. Suppressing the entire immune system is not the way we want to go. We propose a new approach, recruiting and expanding our body's own regulatory T cells in order to generate tolerance and long-lasting effect. By training the immune system to recognize particular antigens and developing tolerance, we can generate a long-lasting therapeutic effect that is safer. Our research shows that the delivery of CCL22 and IL-2, factors that can recruit and expand regulatory T cells right at the skin lesion, can result in safe and long-lasting tolerance. In order to provide more precise and effective therapy and eliminate side effects, there's a need for better therapeutic delivery methods. Despite the fact that the skin is the only organ that we can see and touch and access, when it comes to drug delivery, we deliver therapeutic agents systemically. This results in low amount of the drug reaching actually the lesion. When it comes to topical and ointments, they struggle from penetrating the skin, the stratum corneum, which results in suboptimal performance. New delivery techniques that would enable local and controlled delivery of therapeutics right at the site of interest are necessary. We propose a microneedle patch that is based on a hydrogel, which is a smart band-aid that can deliver drugs directly to the skin lesion. This patch is composed of hundreds of micrometer scale polymeric needles that are large enough to penetrate the outer layer of the skin, the stratum corneum, but small enough to avoid reaching the nerves. This design makes the patch non-painful and self-administered, which will increase patient compliance. The ability of the microneedle to deliver the drugs directly and transdermally to the skin will provide a better and safer delivery and therapeutic outcomes. Our proprietary hydrogel is biocompatible. It is composed of hyaluronic acid, an abundant polysaccharide in our body that is also FDA approved. The patch enables for drug-agnostic delivery, high-loading drug capacity, tunable release kinetics, as well as outstanding shelf life stability. Since the skin is rich in immune cells and other soluble biomarkers, it would be wonderful if the patch can also sample those biomarkers from skin interstitial fluid. We designed the patch to swell and absorb those biomarkers, and in order to retrieve those cells and soluble markers, the patch can dissolve within a few minutes by adding a reducing agent that dissolves the patch immediately, and then we can analyze those biomarkers. We showed that the microneedle delivery of CCL22 and IL-2 can indeed recruit and expand regulatory T cells. We saw that in a skin biopsy, an invasive and painful procedure. Strikingly, we were able to replicate that in a non-invasive microneedle administration that was able to sample those biomarkers and show this increase in proliferation of regulatory T cells. The microneedle by sampling over time would enable us to track the patient response to the therapy and inform the therapeutic regimen. Our first indication is alopecia areata, where 90% of the patients suffer from focal disease and hair loss, and there's no FDA-approved treatment for these patients. Therefore, dermatologists resort to off-label therapies, such as local injection of corticosteroids, which cannot sustain hair regrowth. There is an urgent need for developing non-invasive and non-painful treatment options, particularly for the pediatric population, because painful injections result in low patient compliance. We hypothesized that the microneedle-mediated delivery of CCL22 and IL-2 will restore immune regulation and result in long-term therapeutic outcomes beyond the discontinuation of the treatment. This is in contrast to off-label therapies, where we see that 80% of the patients experience recurrence. We anticipate that the microneedle-delivered therapy would enable safe and long-lasting therapy and therapeutic outcomes, and that the microneedle would allow us to sample the biomarkers and assess the therapeutic efficacy over time. Strikingly, in mouse models of alopecia areata, we've seen that 3 weeks delivery of CCL22 and IL-2 resulted in complete hair regrowth that continued well before the discontinuation of the treatment. We investigated whether the microneedles played a role in that outcome, or whether we could simply inject those components directly to the lesions. Interestingly, sub-Q injection of these factors did not result in therapeutic efficacy. The microneedle-mediated delivery of the therapeutic factors directly to the skin lesion in an homogeneous manner, and their co-localizations with the skin antigens provided by the hair follicles were crucial in obtaining these therapeutic outcomes. We've also shown that similar data were observed in humanized skin transplant model, which shows the translatability of this approach to patients. We have a novel device and a novel drug combinations that are protected by a composition of matter and method of use patents. We have a strong scientific team. I co-founded the company with my collaborator, Dr. Jamil Azi, who is an immunologist and the head of the Transplant Center at the Brigham, as well as Dr. Nuria Puigmal, who is a former postdoctoral fellow in my lab who developed this technology. We're all excited to bring this technology to patients. We locked internal and pre-seed funding and are looking for a seasoned CEO to join our team and raise Series A funding. We started the scale-up manufacturing of this patch and are looking to conduct GMP manufacturing, pharmacokinetic and pharmacodynamic studies, and toxicology studies in 2025. If you're interested to learn more about this exciting technology, please reach out. Thank you very much.